Hi, everyone. This is Dr. Katie Woodley, the Natural Pet Doctor. This is our Wellness Roundup, where we go through all the different life stages from puppies and kittens all the way through to our senior pets. And we talk about brief summaries of what you can do to help your pets achieve optimal health. So what we're going to do is, let me share my screen with you, and we'll get this going. So, all right. So brief intro with me. So a lot of you have heard this already and been with me for a little while now. So I'm a Colorado native. I went to University of Notre Dame, and then straight from there, I went to New Zealand to Massey University to get my vet degree. Ended up living there for 7 years, which were amazing. Became a veterinarian and then moved back to Colorado back in 2013. So I've been a veterinarian for almost 10 years now at the time of this recording. I am acupuncture and Chinese herbal medicine certified. These are two modalities that have completely changed my practice, and I love them. I am very passionate about them. It's changed so many different pets' lives, including my own pets. And I am currently located in Fort Collins, Colorado, but I am wanting to help pets globally. So regardless of where you're at, doesn't mean that we can't help you, but I do want to empower pet owners to be able to have the resources and tools to do a lot of things for their own pets. And then if you need extra guidance, I am here for you, but especially if you don't have an integrative veterinarian close to you. But my mission is to help expand holistic medicine across the globe, so that way pet owners feel empowered and also provide hope again that we can help their pets live a natural life and thrive for a long time. So this is just our Wellness Week wrap up. So we're going to go through the different life stages. So puppies, kittens, adult dogs and cats, senior cats and dogs. And at the end, I have a list of resources. But the really neat thing is that we have ebooks of every single life stage for dogs and cats that you can actually get. And you can also get all the recordings for all the different modules so that you can play them over and over again how often you would like. Maybe it's just once a year before you go into the vet clinic, or maybe it's a resource that you're able to use throughout your pet's life. And same with the ebooks, there's lots of really useful resources. So websites, companies, dosing for supplements that you can use to help your pets. So definitely take advantage of that. So what exactly is holistic medicine right from the beginning? Let's talk about that. So I call myself the natural pet doctor. What does natural mean to me? What that means is we can utilize a lot of the things in our environments, or from like an acupuncture standpoint, so acupuncture, herbal therapy, so non-conventional, so an Eastern type of medicine to help heal the body or help the body heal itself. And one of the things I found is by doing Eastern medicine and integrating into conventional, we find that we get better results. We have less side effects. The pets feel better. This is the same on human medicine too. And we can fix the underlying root problem rather than covering up symptoms. So what we're doing is we're looking at the whole pet or person and taking into account all aspects of your pet's life. So diet, environment, genetics, stress levels, and what is the family dynamic are some of the things that come into play. Vaccines, what drugs have they had? What side effects have they had to those drugs or other things that they've had in their life? And what we do is we view these systems, they're all interconnected. So it's not like the kidney is separate from the GI tract. In conventional medicine, what we do is we go into the doctor, we have, let's say, a bladder problem, right? I have a urinary tract infection. And then I say, you know, my knee's been bothering me. And they go, do they fix it? No, they go, you need to go see the knee doctor. So what they've done in conventional medicine, especially in the human side, is they've separated out every system. We need a diagnosis. We need a name for this disease before we can fix it. But what is the root cause? How are these all interconnected? And so holistic medicine, we take them and the body is one whole thing. And we can look at and say, okay, where is the root problem? Why are these symptoms? The symptoms are a result of an imbalance somewhere. So where is that, and why is this happening? So what it does is it provides a balanced approach to your pet's health, where we can actually eliminate disease and support the body the way that it's supposed to, so that it can heal itself. So there's lots of different treatments in holistic medicine. So I do quite a few of them, but there's a huge range, and I didn't even list all of them because there's so many. There's no way I could become proficient in all of these throughout the rest of my life. So acupuncture, homeopathy, food therapy, physical therapy like rehab, Chinese herbal medicine, Western herbal medicine, aromatherapy, ozone therapy, stem cell therapy. There's just so many different things. But what's really nice about that is because all of those are typically looking at the body as a whole rather than separating it out into different systems. These are all different modalities that we can use together to help get better results with our patients. So how can holistic medicine help your pet? We can improve immune health. We reduce unwanted side effects from conventional medications, resolve the imbalance present in the body, so actually fix the issue. Excuse me. We can slow down cancer. We can reverse kidney and liver conditions. This is real, people. So we can relieve pain, which I'm in, obviously, reduce inflammation from osteoarthritis, promote healing from surgeries and injuries, and treat pretty much any condition, but especially chronic diseases, cancer, autoimmune disease. So what is wellness? So nutrition, environment, vaccines, flea and tick preventatives, exercise, behavior, neutering, desexing, spaying, common diseases and symptoms. So looking at that and how is that affecting our whole body wellness, and then looking at what supplements can help support wellness. So puppies and kittens, this is the first life stage that we typically see our pets at. Not always if we're adopting or getting an older pet, but typically we're bringing home these animals at 8 weeks of age. So you get home and you go, what do we do with these animals? And so that's where we go through vaccine schedule. What do they need right from the start? How often do we need to give those vaccines? What are some of the titers that we can do to truly see if they need those vaccines? What diets do they need? How do we transition over from the food that they were on if we want to switch them to a different food? How do we make the house and home environment safe for them? What parasites are we worried about? How do we treat those? Do we use conventional drugs for that, or can we use essential oils? And how do we introduce these animals to other pets in the household? Where will they be spending their time? Are we planning on doing crate training? What are some safe toys to help prevent foreign body obstructions or cause issues? Socialization is a huge thing with our puppies and kittens. And typically the window when we get them into the house is very small. So we need to ensure that we're getting them into puppy and kitten classes immediately. And yes, I said kittens too. We need to socialize cats, because what happens is we have a lot of anxiety amongst our cats when we bring them into the vet clinic, because they're not used to leaving the house. They're not used to going in a car. They're not used to going into a box. They're not used to being examined. They're not used to being poked. It is very scary. So if we can get them used to more being outside of the house in a safe way, this is huge for them. And then also with dogs especially, is getting them used to being around other people, different looking people, different pets, different animals, being around cats, and getting exposed to unfamiliar sights and sounds. This is really, really, really important. And then getting them used to being handled. So you're touching their paws, you're touching their ears, you're touching their mouth, you're touching, like for nail trims, that's a big way to desensitize them. So turn it into a fun event where they're getting treats. It's a positive experience. It's a fun time for them. And so when do we want to desex them? This is a controversial subject now, because we've just had a 10-year study released of golden retrievers that showcase some of the chronic diseases that can happen, some of the cancer that can happen by desexing your pet at the recommended ages of 4 to 6 months. And so this is huge. We used to recommend 4 to 6 months of age, before their first heat cycle, before they start developing any like behavioral issues because of hormones, we need to get them neutered and spayed. So, but now what we're finding is that if we allow these pets to go a little bit longer, so 2 years of age typically, or even if never. So never spayed, never desexed. What we find is that we can actually reduce the incidence of certain types of cancer. Their ligament strength is going to be stronger. So we're seeing less torn cruciate ligaments, which is like the ACL in people. And we're also getting more normal bone growth. We're having less urinary incontinence. And so what exactly is best? It's going to depend on you. And whatever you decide is okay. And so you just can weigh up more research and decide, okay, maybe we do it sooner. I really don't want a dog that's in heat, and that's okay. Because there's things that you have to be aware of if you're going to have a female that's in heat. They need to be on a leash at all times. If you're outside, especially if they're in heat, they'll take off, they'll escape, they'll run away, especially an intact male. If he smells a female in heat, he's gone. So those are things that you have to think about if you do decide to keep your pets intact. So adult dogs and cats. So what do we do for these guys? So this is typically a stage where everything's happy-go-lucky, hopefully. There's not a lot of disease. Usually dental care is the biggest thing, and routine preventative care. So vaccines for adults, we're typically looking at, you can start titering at this stage. And so what that means is a blood draw to look for certain antibodies against distemper and parvo or panleukopenia for your cats, and see if they truly need that vaccine. If they have the antibodies against those diseases, then we typically can say they should be protected. It's not a guarantee. Sometimes there's non-responders where they're never going to mount an immune response to the vaccines. And so if you've given a vaccine, you're doing a titer, and they're not responding, they have 0 antibodies, you would revaccinate and you would recheck a titer usually in about 2 months. And if they're still at 0, unfortunately, you have a pet that's probably a non-responder. And so that's something where we would need to boost their immune health, make sure that they're safe, make sure that we're doing as much as possible, because there's obviously a defect in the way that their immune system responds to things. You never want to do multiple vaccines all together. So if you live in an area where there is leptospirosis, that's a disease spread through wildlife urine, it causes kidney and liver failure, and it can be spread to us, and we can get kidney and liver failure. You need to vaccinate for lepto every year. There is no titer for that. So that's something where you would want to space that vaccine out. If you need to do the distemper parvo or your rabies, you would space it out about every 2 to 3 weeks. In terms of nutrition, so this is a hot topic. There is not enough time to cover all of this, but keep in mind, a lot of the manufacturers for pet food, the pet food industry, especially for some of the prescription foods, when they did some studies, they found that some of the food elimination trials at foods that were being recommended, that about 80% of the selected pet food diets were contaminated with unidentified ingredients. So had no idea like what was in it, but it wasn't supposed to be in there. And then there's major discrepancies. More recent studies show that there are major discrepancies of ingredients on the backs of bags, including the novel protein diets again. And so there's a lot of different food choices out there. We have raw, freeze-dried, dehydrated, kibble-based diets, canned, homemade diets. So those are all things where you need to work with your veterinarian or an integrative veterinarian to decide what's best for your pet, because there are a lot of pets that don't do well going from kibble to raw, and there needs to be a transition or a buildup of the GI health. There's some great resources out there for home cooked diets. So Dr. Pitcairn has a great book that you can actually purchase, and it talks about all natural health for dogs. And then also there's Donald Strombeck's, where you can get formulated diets that are balanced. That is the biggest thing. If you're going to formulate your own diet, it has to be balanced. We can't just put some meat down with some vegetables and call it good. There's a lot that goes into it. There's also balanceit.com. So that's a big company that you can go to and go on their website and formulate a home cooked diet. Parasite prevention. So you do want to use heartworm prevention monthly. This is also an intestinal dewormer. Heartworm disease is not something to mess around with. So if you have mosquitoes at any time of the year, those are what carry heartworm, and your pet can come down with them. So you definitely need to use that during those times when mosquitoes are out, because the treatment for heartworm is not pretty. The heartworm disease is not pretty. There should never be worms in any creature's heart. So that is one thing. Use Interceptor Plus, HeartGuard Plus Those are two of the medications that have been around for a really long time. They are a very low dose of ivermectin. Typically, you want to stay away from things that are injections that last in the body for like 12 months or more. So I would stay away from things like that. You can also use essential oils to help reduce the flea or repel fleas and ticks. You may find that it's not strong enough, but there's a lot we can do. So in terms of using diatomaceous earth, you need to use food grade. You can use essential oils. There's a recipe, another recipe there. And then you may find that you just have to bathe your pet quite a bit if you're using more natural remedies and you have a high flea and tick burden in your area. So it just depends, and you have to be very careful because those fleas and ticks can spread disease too. So it's all about being aware of what's in your environment and keeping a close eye on your pet, because you don't want them to come down with Lyme disease if you have Lyme disease in your area. So routine care for these guys, typically you're doing yearly exams with your veterinarian. Dental cleanings typically every year. Yes, every year. You do need to have a full general anesthetic for a dental cleaning. I do not recommend anesthesia-free, it's not even sedation, anesthesia-free dental cleanings, because about 70 to 80% of dental disease is underneath the gums. And so what you can do is start brushing those teeth 3 times a week. Make sure that you're doing as much as you can. Even better, do it every day. Make it a habit. And what you'll find is you may be able to extend out those dental cleanings, but that can lead to, if you have dental disease that your pet's dealing with, that leads to pain, abscesses, loss of teeth. They won't eat. It can affect kidney and heart health. So that's something that you need to make sure that you're doing routinely. Yearly blood work is going to track trends for us. So start that at the yearly exam after being a puppy and kitten. Those are really important for us, especially when they do get sick. Hopefully your pet never gets sick, but if they do, we can go back and look at the trends and see, oh, you know what? It started creeping up here, or no, it was actually normal here. So, okay, this is off, and that can help guide us in our decision for treatment. Quality diet with supplements if needed. So if we feel like we need to use supplements because there's some imbalances or deficiencies present in the body, then that's where we can add in supplements, and then making sure we're feeding a balanced diet. And if you notice something is off, don't wait. Just take them into your veterinarian right away. So senior pets. So these are the guys where we start having a bit more issues. They're aging just like us. There's degenerative processes going on in the body all the time. So we need to be hyper vigilant with these dogs and cats when we hit senior. So this is going to vary when we can call a pet a senior. Typically it's around 7 years of age. It's going to depend on size, breed, species. So cats typically live to be in their 20s maybe, if you can. My cats, they were not very old. They were 10 and 11. So things can happen before, but you want to be aware as we're starting to get them into the older ages. You want to be very vigilant of little minor things, because those can be signs of imbalances or bigger problems that are starting to occur inside. So age is not a disease. That is really important to remember, because a lot of times people will say, you know what, his teeth are bad, but he's too old. I'm like, age is not a disease. There's a lot of really good anesthetic protocols. There's a lot of really good drugs that we can use to keep them safe. You want to make sure that they're doing things appropriately if they do need anesthesia, because when we clean the teeth, they feel so much better, because a dirty mouth is a painful mouth. So that's just one example of age not being a disease. And then we want to make sure we're watching for osteoarthritis and slowing down behavior changes. Seniors have different nutritional requirements. Usually we are going to be adding in supplements at this time. And then we do want to limit toxins in the environment, because there's already degenerative processes going on in the body. And so if we add in toxins and other things at the same time, the chance of a disease developing and manifesting, like an autoimmune disease or cancer, is a lot higher. So we do have to be very careful about what chemicals are we using to clean with. Maybe we should use more, essential oils, or making sure that they're appropriate. Lemon essential oil, vinegar, baking soda, rather than using some of those toxic chemicals. And then ensuring that you're not spraying pesticides, things like that in your yard is very, very important. And then the common changes as they get older, they slow down. They're going to get some graying in their eyes. It's called lenticular sclerosis. That's a normal old age change that happens in over 90% of animals. They're going to go for shorter walks. Their hair turns a bit gray, their fur, and those are going to be kind of some of the normal things we see. We do recommend more frequent examinations, even if your pet doesn't feel like you should come in as frequently. So your senior pets, you do want to come in twice a year or more if they have underlying health issues. And this is going to help guide us to make sure that we are doing as much as we can, or if we need to tweak the protocols that we're using to treat the potential issues that are going on. Blood work needs to be done annually, once again. So hopefully this is continuing from that year of age when I recommend doing annual blood work, because we can track trends, pick up earlier on disease, which means we can fix disease earlier before it becomes a problem, before your pet even knows there's an issue. And this is a great time to partner with your veterinarian. Ask questions that have come up, or see if there's other modalities that maybe they can recommend, or maybe one of the vets in the office that you go to just started doing acupuncture and you have a senior pet, and it may be worth starting to add that in. So this is a great time to ask about new things and see what they recommend. And if they aren't able to do those, see who they can recommend and then partner with them. And then titer your vaccinations. If your pet's had vaccines its entire life, the chance is that it's probably protected, but you only know by doing a titer. So that's that blood draw to make sure that they have antibodies against those diseases. So the goal is always to keep the immune system as healthy as possible by reducing environmental toxins and burden to your pet. So that includes what we put into their bodies through vaccines, drugs, nutrition. So some of the ways that we can improve our pet's immune health is nutrition is number one, avoiding toxins and allergens. So making sure cleaning products, pesticides, all of that fun stuff is at a low. Vaccinate smartly and avoid unneeded pharmaceuticals. So things like steroids, if your dog has skin allergies, there's a lot of other things we can do for that rather than using a immunosuppressive. Use supplements to help boost their health. We covered a few of them, but there's a whole range of different supplements that we can actually add in to help them. Make sure your pet's at an ideal weight and is not overweight. Definitely check out those body condition scores, because that's going to help keep you honest if you feel like your pet is lean but is actually getting a little heavy, because that's really common. And then preventing parasites. We don't want to add extra burden to the immune system. So we want to make sure that we're using things that work with the body, or if we do have to use conventional dewormers or drugs, that they've been around for a really long time and we have good safety results and research from those. And the other thing is too, is keep in mind, a lot of people don't want to use those, but our pets are kind of disgusting. They eat a lot of, like dogs, they eat cat poop, they eat their poop, they eat other dogs' poop, they eat rabbit poop, they eat goose poop. Like, it's not worth it. And then guess what? We don't want their parasites either, and they usually lick us. So make sure that we're taking care of any unwanted guests that are in their bodies. So nutrition for seniors, you want to make sure that you're working with your veterinarian if they have any diseases, because this can change their nutritional requirements. So if they have cancer, typically you're using lower carbohydrate diets, but if they have pancreatitis, you can't give them a high fat diet because you're going to make them really sick. So there's a lot that goes into nutrition. We need to make sure it's balanced. Now, if you have a healthy senior pet, check out balanceit.com, because this is a great resource for home cooked diets if your pet's healthy. You can choose the ingredients you want to have. You can pick, do I want multiple days for meals? Do I want them to work out a week's worth of meals? And it's made by a veterinary nutritionist, and there's supplements there. Remember, you do still have to add in supplements. You can't just not give a supplement. And so we can also add in, typically for seniors, they need to be on additional supplements. So antioxidants, natural anti-inflammatories, so curcumin, boswellia, those are really, really good anti-inflammatories. They also have anti-cancerous properties. And we want to support the immune system. So using ashwagandha, astragalus, using medicinal mushrooms, those are all really great sources. Now there's about 2 million on the market. So work with someone so that way you're not wasting money on products that don't work or don't have what's in them. And you're getting the best bang for your buck because we can figure out, okay, this is what's going on in your pet, or this is just normal aging. Let's add these in. So that's why it's really important to work with an integrative veterinarian. And remember, they probably need less calories because they're probably not as active, and we also don't want to create weight gain. So supplements are a big part of that. We've gone through quite a bit of that in terms of supporting immune system, reducing inflammation, supporting detoxification pathways, supporting the liver, kidney health, boosting skin health, especially for our allergy patients, and anti-cancer effects. So some of the common conditions that we do see in senior pets, unfortunately, cancer, heart disease, autoimmune disease, kidney disease, liver disease, osteoarthritis, allergies, I would say cruciate ligament tear, so ACL tear is very common. There's a lot that goes on. Now, osteoarthritis, so arthritis is a very common one. So we want to make sure we're seeing signs, recognizing the signs of pain in our pets. Hopefully you're not seeing them, but recognize them if they are happening. Is your pet slowing down? Is your cat not jumping up on the couch as frequently? Is your dog hesitating to jump into the car? Are they limping? Limping is a sign of pain. They do not have to vocalize for them to be in pain. If your pet is vocalizing, they are in severe pain, unless they're really kind of a baby. So, but a lot of dogs don't vocalize. And so that's when you hear them, they're in probably severe pain. So we need to figure out what's going on. If they're getting more touchy, they're getting grouchy or getting aggressive, if they're being touched in certain areas, it's probably a sign that there's pain there. So what can we do? Acupuncture, this is the thing that I love. I love doing acupuncture, works so well for pain. Most animals tolerate it. And if they don't, there's a lot of other modalities we can use, like laser therapy. This is going to change the actual body's response, and it's going to stimulate production of its own natural opioids. So that's own natural pain control. It can change the circulation. So it's going to increase blood flow to the areas in need, and it's going to help release those trigger points or those really tense muscles. And there's a lot of other things that are occurring in that body too when we do acupuncture. Some of the other natural treatment options, we have Chinese herbal medicine. We can use other more specialized supplements like standard process. And then we can always combine this with other treatment options, laser therapy, homeopathy, food medicine too. So you just want to make sure you're working with someone rather than adding in all of these things at once, especially if you're doing Chinese herbal medicine. Do not do that on your own because there is a lot that goes into it. And you want to make sure that we're treating an individual rather than just looking up symptoms. Leaky gut's a big problem. So this is a big common problem in people too. So what this means is that the GI tract has some inflammation. So every time that we're eating or your pet's eating, what's happening is that some of those proteins are leaking out of the lining of the intestinal wall into the bloodstream, and it's creating an inflammatory cascade in the body. So it's leading to body-wide systemic inflammation. So you can only imagine, like, this is why we say gut health is number one, because this leads to so many problems, including anxiety. I see so many anxious dogs that have gut issues. So what we want to do, we want to build up the gut health. We want to make sure that your pet's on the right diet, that we're using supplements that are going to support the gut health. So probiotics, digestive enzymes, those are really big. Herbs and bone broth, those can help heal the lining of the gut and reduce inflammation, but everything plays a part. Kidney disease in cats, just to cover one of the more common things we see, especially in cats. So this is where you want to make sure you're working with an integrative doctor, because we can use food therapy, acupuncture, Chinese herbal medicine, other supplements to really slow down the kidney disease, even reverse some of it, keep your cat feeling good, keep them out of that acute crisis, and then figure out, okay, what diet's going to work best for them at this life stage, and keep them eating for longer. And by combining all these different modalities that we have at our hands, we can actually prolong their lives, keep them feeling really good, and everyone wins. So overall, we can control so much for our pet's health. We can't control everything, but there's so much we can control. We can control what's going into them, what nutrition, what we're able to add in for supplements. Do we need to add in herbal therapy? Do we need to figure out, do we need an integrative doctor to help work with us so that way we're utilizing all of these different modalities that are going to best suit our own pet for where they're at in their life. So this is a list of some of the resources. I do have a lot of ebooks for different life stages. So senior ebooks for both dogs and cats, the adult wellness ebooks, and also for our puppies and kittens. And those are going to go more into depth about what you can do as a pet owner and use it as a guide throughout their life, where it's going to help empower you to be able to make those decisions on what's best for them while working alongside your veterinarian. And also it may even guide them, the veterinarian, to implement some of those into their own practice to help better improve the health of their patients. So make sure that you subscribe to me. Follow me on YouTube, Instagram, and Facebook, The Natural Pet Doctor, and make sure you check out my website, thenaturalpetdoctor.com. If you feel like you want some more individualized care for your own pets, feel free to reach out to me. You can always send me an email at naturalpetdoctor@gmail.com. I love hearing from you all. I'd love to hear your thoughts, your questions, and then we can work together to keep your pet thriving naturally. So I'm Dr. Katie Woodley, the Natural Pet Doctor. Take care.